there are complicated factors that are intersecting with empathic ability. Something like emotional intolerance or emotional avoidance. In other words, the stove's too hot to touch. So it doesn't mean that the person can't empathize, but more that there are situations where they won't. And then that, of course, raises the question of whether or not that's conscious
Hmm.
or unconscious. Okay, well, welcome everybody to this, our third installment of the seminar series. I'm joined here today by my two psychological associates, Mr. Danté Spencer and Dr. Deanna Young, both of whom work in my practice and do assessments and psychotherapy. Dr. Young recently graduated with her Doctor of Psychology and Mr. Spencer is all but dissertation status, yeah?
Yeah, another
Yeah.
month.
Yeah. How long?
Another month. So I'm supposed to do my oral defense in December.
Okay.
So I'm waiting on that confirmation.
Very exciting.
Yeah.
Very exciting. So today we're going to talk about an article that appeared in 2022 in the journal Focus, the Journal of Lifelong Learning in Psychiatry, which is published by the American Psychiatric Association. It's by Igor Weinberg and Elsa Ronningstam, and it's called Narcissistic Personality Disorder: Progress in Understanding and Treatment. So I'm gonna, as I've done in previous episodes, I'm going to read a little summary of this article. But before I begin, I just want to remind viewers that um, Dr. Young and Mr. Spencer are both available to see patients who live in California. They both have a great deal of experience working with a wide range of presentations and disorders, not just NPD and pathological narcissism, although that is what we focus on here in the practice, but we also treat other issues as well. Anything from chronic mental health issues to issues with identity, issues in relationships, and other personality-based issues as well. So if you're interested and would like to learn more, you can find out more about both of them and also how to work with them on my website at healnpd.org. All right. So this week's discussion focuses on a 2022 review called Narcissistic Personality Disorder: Progress in Understanding and Treatment. The article traces a decade of process in understanding and treating NPD. It contrasts the traditional categorical diagnosis, so the kind of diagnosis that you find in, or the kind of diagnostic criteria you find in the DSM, with the newer dimensional model, which examines functioning across four domains: identity, self-direction, empathy, and intimacy. This approach allows a more individualized view of the disorder and recognizes that narcissism fluctuates across states rather than existing as a fixed type, which is something that we discussed last time. Um, Weinberg and Ronningstam describe how grandiose and vulnerable narcissism often coexist within the same person. Grandiosity involves confidence and entitlement. Vulnerability reflects shame, sensitivity, and insecurity. These states may alternate or blend in the same individual, creating the paradoxical presentations that we often see in treatment. The authors identify several interconnected mechanisms: instability of self-esteem and emotional dysregulation, rigid cognitive styles, interpersonal dominance or avoidance, and nuanced difficulties with empathy. Because these domains tend to reinforce each other, treatment needs to address their interdependence rather than approaching them as isolated symptoms. Developmentally, there's no single pathway to NPD. It can emerge from overvaluation and indulgence, from neglect and criticism, from inconsistent emotional attunement. There are, as the authors say, many routes leading to similar outcomes. Long-term studies show that narcissistic pathology is persistent but changeable. Improvement tends to be gradual, supported by motivation, life experience, and a stable therapeutic relationship. The paper closes with shared principles across effective treatments. Those include setting realistic goals, clarifying the frame, focusing on self-esteem and relational patterns, building a reliable therapeutic alliance, and monitoring the countertransference. Progress unfolds through ongoing attention to rupture and repair, empathy, and the patient's capacity for reflection. Ultimately, the article presents NPD as a disorder of self-regulation and relationship, one that can one that can improve through steady, empathic, and disciplined therapeutic work. Okay. So, what do we think? Impressions, questions, strong, vehement disagreements? What do you think?
I was really interested in what they said about empathy and how like the nuance of it,
Hmm.
and like cognitive empathy versus like emotional empathy, and
Okay.
how it's so hard to even start to differentiate that within yourself. Like what does that look like?
Mhm.
What is that? And then how do I see that in someone else? Um, that was interesting. And then also the part where they talked about the stalemate between the clinician and the patient. That was really, really interesting. And I imagine a lot of people come up against that. Quite frustrating experience for both patient and clinician.
Yeah, yeah. Yeah, they really spent some time talking about that particular facet of treatment with this population.
Mm.
Yeah. Um, what what do you guys think about this distinction between cognitive and I guess emotional empathy?
Yeah, it's really interesting because, empathy, according to the DSM, is one of the criteria, for NPD. And it's interesting because Weinberg and Ronningstam, they highlight that evolving understanding of empathy in NPD, I guess, rather than like a simple lack of empathy, which can
Mm.
be, I guess, misconstrued, right? But the problem they're saying often lies in the selective engagement, like Dr. Young was talking about. Um, I guess it's like breaking that down is that narcissistic patients like possess intact cognitive empathy, so they can kind of think about the empathy, but not maybe feel it. Um, that emotional empathy. So I guess that this impairment where they're not feeling it, but they can cognitively think it. Um, they say it may stem from not from the ability, not from the inability to feel empathy, but from rather more of like an avoidance, or what they said is emotional intolerance, or like some sort of self-protective diseng disengagement.
Yeah.
So it's almost like for survival, it seems.
Well, it's one of the reasons, and I think they go through this in the article as well. I think they sort of trace the evolution of the empathy criteria in the DSM, right? Going from the DSM 3R, I think it is, in the 1980s, when the diagnostic criteria for NPD were significantly revised to be kind of more in the form that they are today. Um, the empathy piece was more about an inability to empathize, right? Sort of this lack of of an empathy capacity. Whereas now it's changed to something more like an unwillingness to empathize.
Mm.
And that kind of gets at what you were saying there, Dante, that it's sort of like there are complicated factors that are intersecting with empathic ability, right? Something like emotional intolerance or emotional avoidance. In other words, the stove's too hot to touch,
Mm,
basically. Um, so it doesn't mean that the person can't empathize, but more that there are situations where they won't. And then that, of course, raises the question of whether or not that's conscious
mm,
or unconscious, right? We know that across a lot of different situations, especially with different attachment styles, avoidance can just be kind of this overlearned strategy that shows up whether or not the person means it to or even wants it to. I think you were going to say something there, Dante, and I kind of kept going.
Yeah, yeah. I mean, I'm just curious with what you're saying. Do you feel that like this either attachment reaction or this you know I guess lack for an ability in those moments to feel the empathy, do you think that has to do with, I guess, being activated in some sort of shame or something that affected the esteem? So, meaning, I guess my question is like, if all things are well, um, can a person who exhibits, NPD, symptomatology, can they feel empathy normally, except for in these states of maybe dysregulation brought on by failures or shame?
I mean, I would agree with that, but I kind of want to pose the question back to you guys and see what you think about that. It seems like you that might be your idea about it, Dante.
Yeah, because it's like what's in those moments, what's preventing the natural organic feeling of empathy? What's blocking that? Is it is it what we're talking about, the feeling of or just dealing with potential conflict? Is it that their self states are so fragmented in those in those particular situations where they can't, feel what's going on with someone else? Is that impacting that? If they are in a normal state, can they naturally feel empathy of others? I guess those are kind of the ideas that I'm um, oscillating between.
Yeah, yeah. How about you, Deanna? What are you thinking about this?
Yeah, I'm thinking about how much it sounds like a trauma response,
Mm,
and I'm thinking about closeness and how um, just in what we're talking about, how like the experience of closeness, although it might be like deeply desired, is like that hot stove, perhaps, and perhaps that's when things are activated. And I could see how this pattern might replicate itself when it when that that desire to be seen is so palpable, but also so painful to pursue, and then those defenses come out because it's a traumatic experience, maybe overwhelming, maybe dangerous.
I could imagine how what you guys are describing right now would translate to almost exactly what we see in actual clinical presentations of NPD, right? Where the person has this sort of cognitive capacity, right? They can know something up here, but not necessarily connect to it on the level where it counts, right? Like kind of like what you're saying, Deanna. They and I find, and I'm sure you find this as well, um, in many presentations of pathological narcissism and NPD, there's kind of this robust intellectualizing defense. The person thinks about experience more than feels about experience, especially when it is evoking their underlying attachment paradigm, right?
Mm,
There's oftentimes an underlying attachment avoidance dimension, which is trauma based. I mean, that's verifiably trauma based, right? Um, and so it is like a hot stove. It's like, whoa, too close. That's dangerous. That's dangerous stuff right there, right? I'm not going to let it get too close to the parts of me that matter, the parts of me that I'm protecting, consciously or unconsciously. But I can kind of create this abstraction in my mind and know about that. It's safer that way,
mm,
right? And I think that could account for that disparity we see between, what the authors of this study are calling emotional empathy versus cognitive empathy. Um, but I also think that empathy is more nuanced than that, even. right? Is it I mean, can you think of anything more complicated than empathy? I mean, really? Like for me to somehow generate a model of what I think your subjective
Mm,
experience is in this moment, you know? I mean, there's like abstraction upon abstraction upon abstraction. Like what am I even constructing this model out of? Like your tone of voice, your facial expression, your body posture, like the knowledge of our relational history together, like things that I happen to know about being human but don't necessarily know them in like this way that I represent to myself in the moment. It's like these are like really robust um, capacities that our species has, you know. Um, so, but I don't think that they're capacities that we're necessarily born with. The way that I think about it is that over time, as we learn from our experience and as we sort of create this foundation through repeated relational interactions, our ability to sort of imagine how somebody else is feeling inside of them, irrespective of how we are feeling in that moment, it grows. But even though it's like this robust capacity, it's like also like really kind of fragile in a way. Like you were saying, Dante, the more upset a person is, I think the less they're able to empathize with other people. You know, if I'm in a state of emergency or crisis, my ability to empathize with other people is going to go way down in that
mhm.
moment, right? If I'm preoccupied by a concern that somehow implicates my own safety, it's going to be hard to sort of set that aside and focus in on how I think somebody else is feeling. Um, and when we talk about personality disorders in general, these are conditions that are characterized by hypersensitivity, right? By like not hyperarousal. The the person is easily triggered into states of emergency where they perceive interpersonal or psychic or emotional threat where none may actually exist, but it doesn't change their perception. And in those states of mind, yeah, I think empathy goes down, just like it does for anybody. So it's not so much a difference in kind, I think, as it is a difference in degree, you know? Um, and I think the authors are kind of getting at that complexity in this article, where they're saying, even the way that the DSM thinks about empathy in NPD has changed over time. It's not really thought of as like a deficit so much as this lapse in certain situations.
Yeah, and as you say that, I'm just curious about this lapse that you're talking about, or this impairment in emotional empathy, and how much that has to do with a primary caregiver upbringing. The authors discuss the developmental factors, where they kind of reject any like single causal model, but kind of instead describing like multiple pathways to leading to NPD, which I think is important to talk about. And they say that a lot of these issues are rooted in neglect and rooted in abuse or emotional deprivation, and then also the over-evaluation potentially and overprotection or indulgence by primary caregivers. Children that are excessively praised, kind of without realistic feedback to what's really going on, and they can develop this inflated yet fragile self-state. But I guess I always wonder how much of it is um, this is developed from primary caregivers. You know, um, I wonder if the lack of empathy. You discussed Dr. Edson certain times where the person is under so much self stress that they're not able to empathize with others, and I'm wondering like if primary caregivers, in their life in those at those times, were not able, because of their own stress, were not able to, um, I guess, hold or provide space for empathy. And I wonder how much is it the development or the lack of that being provided, or just as I guess, a consequence of um, avoidance.
Yeah, I mean, if I hear you right, I think it sounds like what you're saying is that the absence of empathy, certain kinds of empathy, or some kind of empathy lapse during critical
Mhm.
developmental periods might translate then to this kind of empathy lapse in adulthood.
Yeah, like for example, if there was a child over and over that experienced humiliation or rejection, they may construct somewhat like potentially grandiose fantasies as a defensive compensation, for the neglect. You know, um, yeah, I'm just wondering how much of the parents' lack of empathy influences. If we're not given any kind of empathy by our primary caregivers, what is our development versus if we had a lot in
Mhm.
our relationships, I guess, with ourselves and with others. That's
Mhm.
I wonder how much of it is from our primary caregivers, but
Yeah,
developmentally.
yeah, yeah. Well, you and everybody else, right? I mean, to a certain degree, like, and I don't, I know that sounds glib, but what I really mean is that's what the same question that the authors are sort of asking here as well. And I think the field of clinical psychology at large is sort of asking, um, what kind of experiences translate over time to the development of pathological narcissism? Where is the intersection between heritable traits, let's say, like temperament, and versus environmental factors, like chronic empathy lapses, or even something more like an unsafe, emotionally sadistic early care environment? Um, what's the dose? What's the required dose of that? You know? How do they interact and reinforce each other? If you got strong heritable traits, does that mean you don't need very much trauma? If you have,
Mm,
if you don't have strong heritable traits, does that mean you need a lot of trauma?
mm,
Or are they somehow independent of each other? Is there a recipe for pathological narcissism that could be reproduced over and over again if that were ethical to do, if we could raise kids under extremely controlled environments and be like, this one has empathy lapses, this one has a secure base, this one's overindulged, and we could see, how that turns out. I think these are questions that get to the heart of where the field is right now with respect to NPD. Deanna, I'm curious to hear your thoughts as we're kind of going back and forth about this.
Yeah, I'm thinking about this article I read once, and it said that like NPD is on the rise. Like there's
Mhm.
more people being diagnosed with it. And then I also remember Mick Williams writing about how a rapidly changing society and environment can really impact somebody's self-development
Huh.
and someone's sense of security and continuity. I know that can be kind of an environment to create pathological narcissism, because how how are you going to know where you stand when you never had a place to stand,
Yeah.
or like a stable place to develop. Even, and I mean, it's my perspective. Dante, what you were saying, I think everything goes back to caregivers, but that's just my thing. Um, but even on the more macro, like society, I think has a huge impact on self
mm,
development. Um,
mhm.
I agree, and I also think, and to kind of chime in with the author's perspective here, um, it may be this may be overdetermined, right? And by that I mean there may be multiple causative factors that combine in different ways. You know, some people simply are more resilient for what constitutional reasons, as far as we can tell, to early adverse childhood experience, you know? And some people are exceptionally vulnerable. Again, it's hard to say exactly why. Um, we don't really have the longitudinal studies that would help explicate this, that would help kind of reveal, how all of these factors come together. I'm thinking about my dissertation research, and my hypothesis was that both vulnerable and grandiose presenting people with NPD, right? Or not even with NPD. My hypothesis was vulnerable and grandiose narcissism, because I wasn't just looking at people with NPD, right? That they would share this early narcissistic wounding, where there was a kind of lapse in empathic attunement, basically. And I got at that by self-report measures that looked at dynamics in their relationships with their maternal figure and their paternal figure and those kinds of things. But that vulnerable narcissism would also be positively correlated with peer rejection, essentially. So being bullied in school. So that the early wound set up that defensive matrix you were describing, Dante, where there's an inflated or grandiose self to try to compensate for the early wounding. But then the subsequent peer rejection damages that defensive shell and makes it more prone to collapse. So, it was a little bit of a heavy-handed lens to look through, I guess, but I think it's getting at what we're talking about here. The coming together of multiple factors. I think the authors even, just looking at this real quick here.
They do mention how NPD is an adaptation to neglectful parenting. That was interest, kind of goes to your point, Dante, what you were saying.
Yeah, I think we've long known, at least from clinical studies, clinical writing, that there's this interpersonal sensitivity to feeling unseen, misunderstood, mischaracterized, neglected in a sense. And frequently the sense that's made out of that is, well, okay, I mean, if that's a sensitivity in adulthood, it must bear some relevance to what the earlier relational experiences were in childhood, right? If every time somebody raises their hand, I flinch, well, it probably means that I've been hit, and not just once, lots of times. And I think it's a pretty straightforward analogy to being hypervigilant about feeling misunderstood or ignored or characterized as a bad object. I don't think that comes from genes. I think that comes from experience, and I think it's just common sense that comes from experience.
Yeah, earlier you mentioned that like empathy is we're not born with it. And I don't know if I'm just an idealist, but I feel like we are born with empathy. I feel like it's necessary for our like our communal species to be empathic and to be able to connect in that way. And kind of to your point about like environment and how experience impacts that, I feel like we're predisposed to be empathic and we're predisposed to connect with other humans and other beings. Um, and so to me it seems like um, quite a trauma to have that be interrupted or to have that be um, uh, like developmentally delayed because of experiences. And that's kind of how I see it. Kind of like empathy robbed almost.
Mm,
Mhm.
yeah. Yeah, that's a really good point because it's like it's almost like natural organic development, should take place with, good enough primary caregivers. But then when we have some sort of environment with that's rooted in neglect or abuse or some sort of emotional deprivation, then the normal development doesn't take place, and so stuff is off. Um, but also at the same time, like if we're talking about like that over evaluation or the overprotection or the overindulgence by like primary caregivers, almost on the other side, it doesn't really give them a reality check to
Yeah.
develop resiliency, to tolerate loss or rejection or pain, or to at least have support or emotional support during those times of dysregulation, of rejection. So it's just interesting, like what Deanna's saying. It's like something was off that impaired that natural uh, empathy that we usually have, just through relational dynamics.
Yeah, yeah. I think your point's well taken, Deanna. I agree with you that we're born, if you have like a, barring some kind of awful thing, right? That we're born with this capacity to connect, right? An innate attachment orientation, which requires to some degree an empathic capacity. Um, but I also think that, little kids are like really egocentric. And they don't even know that like other people have minds,
Mm,
before a certain age. And so I think it just gets to just how complicated the concept of empathy is,
mm,
how it functions on multiple levels, some more symbolic and abstract, some just visceral and hardwired into our DNA, so to speak. It is well taken, your point. I appreciate the distinction. Um, I was going to say something about, darn it, Dante, can you just recap your last point real quick? Because I had something to say about it. I can't remember.
Yeah, I was kind of saying, to Deanna's point that, naturally it would seem that we have this empathy develop, but then when uh, stuff happens in life by our primary caregivers, like neglect or abuse or emotional deprivation,
Yeah,
um,
yeah,
then then it just um, doesn't really develop like it
yeah.
like it should.
Well, I think sometimes people they think about overindulgence as like the case that disproves the theory, right? Well, if neglect or trauma is what causes narcissism, then what about the golden child who was overindulged? How do you explain that, right? And I think to your point, Dante, that is itself a kind of neglect. We need to to be allowed to experience loss and limitation, and we need to be helped to negotiate that experience such that we can internalize it and develop an identity that's flexible enough to weather disappointment, failure,
Mm,
rejection,
mm,
right? And what we see in some narcissistic presentations is this um, uh, inflexible and brittle identity that's organized around excluding the possibility of limitation or loss. I mean, that's what we call
mm.
grandiosity, right?
Yeah.
Grandiosity isn't just, I think my shit doesn't stink just 'cause, you know, it's 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 typically an inflexible, narrowly defined and fragile conscious idea of self that when it collapses produces all the trouble that we tend to see, that what brings people to therapy, right? Depressive affect, feelings of emptiness, attachment, anxiety, suicidality, um, stuff like that.
Mm,
And I think the authors get at a good point here. It's somewhere, it's real, just if you blink, you'll miss it. But in the article, they're talking about the differences between explicit self-esteem and implicit self-esteem. And they cite a study from 2013 that demonstrates that people with high levels of pathological narcissism, the higher the pathological narcissism, the greater the disagreement between explicit and implicit self-esteem. So explicit self-esteem is how they see themselves consciously, what they'll tell you. Implicit self-esteem is how they really seem to feel about themselves.
mm,
And that the wider that gap gets, the more we start to approach, the domain of splitting and dissociated self states and all the things that, we start to conceptualize on the level of trauma, right? Um, these things can't get close to each other because it's unbearable, in other words. They have to remain dissociated.
mm,
So and the authors really characterize pathological narcissism as a syndrome that's not just defined by grandiosity. It's defined by the instability of self-image and self-esteem. They even say NPD is a disorder of self-esteem dysregulation, right? And that the grandiosity can be inverted. It can be, I'm the best at being terrible. It can
mm,
be, I'm the worst person that ever lived. It can
mm,
be egocentric in that way. Everybody hates me. No, I'm sorry, nobody's paying any attention. Oh, that's even more wounding than everybody hates me,
mm.
you know?
Wow.
So, I think people get lost in the weeds where they're like, oh, well, grandiosity is narcissism and the vulnerable symptoms, that's just noise, basically. That's comorbid BPD or that's something else, you know? And what they're missing is no, there's a higher order construct that contains both grandiosity and collapse. And the higher order construct is what we call pathological narcissism.
Mm, mm,
I really like that they kept going back to that point. I noticed in the article they kept saying like it's a disorder of self-esteem,
Yeah.
dysregulation, and that helped me really um, kind of reframe my perspective of it because I feel like a lot of what's taught and what's out there is like this focus on the grandiosity and this focus on kind of the symptoms, but not really looking at what really is pathological narcissism, which I feel a lot of us can connect to, is just like the problems with self-esteem regulation.
Yeah. And that it's on a continuum, right?
Mm-hmm.
It's not like, oh, those people over there have narcissism.
Mm-hmm.
Over here, we don't have any of that, you know. No, it's like everybody has to construct an identity and everybody has to have feelings about being who they are. And those feelings, well, they come from experience. And the building blocks of the identity, those are experiential too. Now, some of it primed maybe by genetics, but the parts that really matter, the parts that mean something, those are experiential. And they're really complicated, turns out.
Yeah, and it's I really like how the article starts to talk about some sort of like successful treatments and the difficulties in that just like the longer term
Mm.
success of just showing up. Obviously, we know NPD dropout rates are significantly high. You can imagine if there's fragile self states, then they don't want that's difficult to talk about and to face. There's a lot of shame in there, and so dropping out of therapy is common. But it's interesting to see how the healing aspect of NPD is through that therapeutic relationship. It's almost like kind of mirroring what might have caused it in the first place.
Mm.
So it's like
Yeah.
almost we're becoming, sort of a new primary attachment figure to really be able to face shame and to talk about failure and to um, be authentic um, without needing to impress or needing to do something other than be yourself. And so it's interesting how important that is that it's actually healed through a relationship, through
Yeah.
relationship.
Yeah, this is what one of the reasons I like working with you guys is because the relational perspective comes up again and again, right? Which to my mind is the most that's where the heart of it is. I mean, literally, you know. And the idea, yeah, that a relational wound produces maladaptive adaptations, and the only cure is a different kind of relationship. You know, what was broken relationally needs to be healed relationally.
Mm, yeah, and that takes time, right? Can't do that
Yeah.
overnight. Yeah. They mentioned um, balancing empathy with firmness, validation with boundary setting, and curiosity with containment. So that's interesting. That empathy with firmness.
Mhm.
What do you make of the empathy with firmness?
Well, my mind goes to that old dictum that you validate but don't gratify,
Hmm.
you know. That
What would be some examples of that, maybe?
well, so I think like the authors write about, they don't use this term, but this is what they're writing about, contingent self-esteem. That
Hmm.
the self image is excessively referential. It's like, how do you see me? How do you see me? How do you see me? And and the person is constantly looking for that feedback to try to shore up this ultimately fragile self-image. Um, and that's normal in early childhood, right? Are you proud of me, mom? Are you proud of me, dad? Did you like what I did? Did you see my drawing? Did you come watch my play?
Hmm.
Did look what I can do, right? And that's normal behavior in childhood to use caregivers instrumentally in that way, right? But ideally, we are able to mature out of that way of relating, such that we don't have to use other people to help shore up this what should be an internal process at that point, mostly. Um, but pathological narcissism and NPD in particular, the person is kind of stuck in that immature way of relating that's defined by deficits and self-esteem regulation. I mean, that's what we're talking about, right? So what they're trying to do is use the therapist as a self-object to instrumentally to shore up self-esteem, the same way a little kid does. The therapist's role is to provide enough empathic attunement that the person feels seen, but without necessarily gratifying that contingent self-esteem mechanism. So the person is like, aren't I great? Let's say. And the therapist's job is to reflect back, I really hear how important it is to you that I see you in a certain way or that
Mm.
you're seen in a certain way. And I can imagine how good it would feel, let's say, to hear, yeah, you're really great, you know, but without actually saying it. Stop just
Mm.
short of gratifying that. Because if you gratify it, it just perpetuates that maladaptive way of constructing self-esteem. But if you're able to pivot and hold it within the relationship, I see you and I see what you're feeling. That's
Mm.
that's the food that actually nourishes, right?
That's empathy.
That's empathy. That's the real stuff. Yeah. Yeah. So that's what they're
Mm.
talking about. Empathy, but with firmness, with boundaries. Yeah.
Mm.
That's making me think about holding the tension because
Mm.
I guess you're kind of describing that I'm feeling tension, because it's like one person wants something and the other person's kind of staying in the process, and there's a tension there.
Mm.
It's easy to precipitate a rupture. Like you can end up in rupture uh pretty easily that way. And then you get to make a repair, hopefully. It opens the door for even more empathy.
Mhm.
You get to hear all about how painful or frustrating it is that you're not going to give them what they want,
Mm.
what they need, let's say, from their perspective. And you get to respond to that in an empathically attuned but firm way and hold the loss together,
Mm.
you know? And this
Yeah.
is how the self grows. This is how
Yeah.
the change happens. Not just doing it one time, but doing it 10,000 times over the course of however long it takes. That's how any of us built those capacities. Why should it be different with a, a patient?
Mm.
The patient's just more complicated because you got this adult will, that's overlays the top of it. They can just leave whenever they want. And so that's what accounts for the like 60% dropout rate or whatever the statistic was they cited in the article. There's just a lot of opportunities for things to get too hard, for the fire to get too hot, and for the person to bail.
Mm. Yeah, it's interesting. They say younger patients and those capable of reflective self-observation show better outcomes, which is interesting. But then there's also the argument that people, um, I guess, who could be diagnosed with NPD can start to improve with age because,
Oh, right. Yeah.
and I want to get this, your input on this, but because of they're realizing that like this type of behavior doesn't work with people.
Life's gonna, you know, kick you where you're vulnerable sooner or later. Like, you see the same thing in BPD actually, that the erratic, kind of disorganized aspects of BPD tend to soften over time. The older a person gets. Partly that's due to hormonal factors, I would
Mm.
imagine. Regardless of sex, when we're young, we're like, all right, let's do this, and then you get old enough and you're like,
I'm tired.
really again? Got to do this again, you know? I mean, maybe that's just
Yeah.
me. I don't know. But
Oh.
it's I think there's a tendency to kind of chill out a little bit. Um, but the perceptual distortions can actually, I think, get more and more complicated potentially over time.
Mm.
As because if we're conceptualizing this as let's say a form of complex trauma, right? Even okay, look, let's say we'll be as generous as possible and we'll say let's pretend that this doesn't start with trauma. Let's pretend that this starts with a cocktail of heritable traits, all right, that prime a person to be narcissistic. Fine. I disagree, but just for the sake of argument, let's say that's true. Over time, those traits are going to cause multiple issues in the person's life that become a complex trauma syndrome,
Mm.
right? And
Mhm.
the longer that goes on, the more messed up it gets, you know? So whether we're talking, you got this, sorry, you drew a bad hand and you got NPD. Sorry, kid, like even if that's what we're talking about, we're still going to end up with a complex trauma syndrome.
Mm.
So,
Yeah, it makes a lot of sense because there's trauma, then you get into relationships, and more trauma is caused from ruptures and not being able
mhm.
to repair. And there's a lot of loss, a lot of rejection, a lot of abandonment.
Yeah.
Yeah,
And then
makes a lot of
all
sense.
the compensatory, explicit self-representations that are imposed on that experience you know, it wasn't me, it was them, right?
Mhm.
It's always them until you end up with this person who's essentially paranoid, totally alone,
Mhm.
you know, with a self-image that's completely decoupled from reality. Um, I'm not saying it has to end up that way, but I could
Mhm.
certainly imagine that it could. So, you know, I think that's kind of what they're talking about when they say that, over the lifespan, these tend to be stable underlying issues. I think that discounts um, things like, long-term therapy. I don't think that data is necessarily inclusive of the changes that can come from sitting on a regular basis and hashing this shit out. You know,
Exactly.
if you stick around and your therapist isn't a complete dud, I think you're going to see some positive changes.
Yeah, it would be kind of hard not to, right? Um,
Yeah, yeah. I don't know. Maybe that's a good place to end.
yeah.
So give us a call. I don't know. I don't know. No. Thanks everybody for joining us. I mean, yeah, give us a call. But thanks everybody for joining us. We love the feedback, by the way. Questions, comments. Give us a sense of how we're doing here, if what you're hearing is helpful. If there's anything in particular you'd like to hear us cover in a future episode. Um, Dante and Deanna, thanks so much for your contributions, and we'll see you all next time.
Thanks, y'all.
Thanks, guys.